Welcome back to the County News Podcast. I'm Nicole.
And I'm Charlie.
And we are in the throes of getting ready for the NACo annual conference. How is it going for you?
I'm on track for everything I'm trying to do in the next month, so I'm feeling pretty good.
Kind of miraculous because it's earlier this year than it has been before. It's July 12th through the 15th, but we'll talk about that more in a little bit. I'm glad things are going well for you. And today, we're also kind of timed right now at the end, just coming out of Mental Health Awareness Month. And it's been amazing, the response from members to our Mental Health Awareness Month content, because I think folks see so many aspects of county work reflected in these mental and behavioral health issues. And because that's the case, you could have talked to so many people about mental health for this episode. Why did you choose Judge Steve Leifman from Miami-Dade County?
Well, if I can identify mental health awareness in the justice system with anybody over the last 10 years, it's been Judge Leifman. Former Miami-Dade County Commissioner Sally Hayman was an early champion of him, brought him along to NACo events for years, and then he was one of the founding members of our Stepping Up initiative that launched in 2015, aimed at reducing the number of people with mental illness in jails. And he's been a mainstay in all of our programming over the last decade. So I didn't think there'd be anybody better. He can talk about it until the cows come home, and we did.
And what I loved about this interview that folks are about to hear, he speaks passionately about these stories, these examples that have stuck in his head over the years, but combines that so effectively with the data. He's got the receipts that show that these issues are important. He knows who they affect and how much. And he knows that some of the solutions they're implementing in Miami-Dade County are working. So it's really exciting to see him bring the stories and the data together.
And he demonstrates that you don't need to make major changes to your system to try some of these ideas out.
Well, let's give it a listen. Hear what he had to say.
Judge Steve Leifman from Miami-Dade County. You've been a NACo mainstay for almost a decade. We launched the Stepping Up initiative in 2015. You were part of it back then. I'm sure you were part of our programming beforehand. Former Commissioner Sally Hayman has been one of your huge champions, and she's been a big part of NACo and the large urban county caucus. So you've been on our radar for a long time. But tell me about your professional history and emphasis on mental illness in our criminal justice system. What effect does mental health have on the criminal justice system?
The cost to local county governments because of not treating this population is so exorbitant. It's almost mind-boggling. I think if taxpayers understood how many billions of dollars were getting wasted by not treating people, they would be stunned, and we might be able to actually fix the problem. I mean, my own county in Miami-Dade spends about $840,000 a year. A day. Okay, $840,000 a day. That's about $310 million a year to warehouse about 3,200 people with serious mental illnesses in its jail. And when this population is in jail, they don't receive any kind of federal benefit. There's no Medicaid, there's no Social Security, there's no insurance. And so the local county government is really stuck bearing the entire cost. And now maybe the cost would be worth it if these folks, when they left us or left the local jail, were coming out better than when they came in, and we would reduce, we would improve public safety, we would get better outcomes, but they're worse than when they came in. And so they just continuously cycle. And so the system is so backwards and upside down.
How did you come to be so focused on the mental health issue?
My personal story actually began in the year 2000. I was getting ready to go on the bench. At the time in Florida, judges had absolutely no training, no knowledge, no nothing, unless I guess it was a family issue. We knew nothing. And so I was approached by the assistant public defender and the assistant state attorney, and they asked me if I would speak to a couple whose son was in jail on a case I was about to hear. And so they brought back this lovely, very sophisticated couple, and they were just terribly distraught. The mom was crying, the dad was shaking, and they literally began to beg me to get their son help. They told me that he was brilliant. He had gone to Harvard. He had a late onset of schizophrenia, and he was cycling between homelessness and jail. And so as I started to go back into the courtroom, the mom stopped me, and she's like, Judge, there's one more thing I need to tell you about my son. She said, not only is he brilliant, but respectfully, he probably knows more about the mental health system than you do. And I looked at her. I had no clue what she was trying to tell me. And I said, excuse me? And she said, oh, you see, my son is the former head of psychiatry at Jackson Memorial Hospital. He was a Harvard-educated psychiatrist, had a late onset of schizophrenia. He started having what we call religious ideations, thinking that God was talking to him directly. And so, to be closer to God, he cashed in his life insurance policy and he bought an airline ticket and he flew to Israel. And within 3 weeks, he was running around naked in the Orthodox sections of Jerusalem. And so the Israelis deported him back to Miami, where he had become homeless and started cycling. He eventually, that day, ended up having a full-blown psychotic episode in my courtroom, screaming that his real parents had died in the Holocaust and the people in court were from the CIA and they had come to kill him. And his case turned out to be a window to everything that is wrong with both our community mental health system and our criminal justice system. And it's just, we're so busy doing our jobs, nobody has taken the time to see if it actually is making a difference or working. Dade County at the time was spending between $1 and $2 million a year on psychological evaluations for misdemeanor defendants so that we could adjudicate them incompetent to stand trial and release them back to the street without any services. And that's just what you did. And that's, what you were taught to do. And it didn't matter. It didn't make any sense. And so as a result, again, of his case, I had a summit that year, and I jokingly tell people, but it's true. One of the best things about being a judge is when you invite people to meetings, they come, even if they don't want to be there. And so we put together a 2-day summit, and I invited all the important traditional stakeholders in our community, which included county commissioners, the equivalent of our sheriff, our police chiefs, our state attorney, the public defender, our State Department of Children and Families, law enforcement, corrections, all these stakeholders that you really need to develop a collaboration to change this. And the first half day, we mapped out the intersection between criminal justice and mental health. And what we found, frankly, is that we were embarrassingly dysfunctional. Us so-called healthy, sane people had designed a system to fail perfectly, and it perfectly failed. And it's expensive. And it's not that we don't spend money in mental health in America, we just spend it in most of the wrong places. 70% of people in jail today in the United States, they either have a serious mental illness, a substance use disorder, or both. I tell people we need specialty courts for the 30% that don't. And we need like a therapeutic jurisprudence system for the lower level case defendants that do, so that we make sure that they get access to the care that they need and that they stay in with their treatment and they get into recovery. Because the way we do it now really is the definition of insanity. It's not working. It's very expensive and it's hurting people. And we just started putting a coordinated system of care together and having warm handoffs to people to make sure people got what they needed. It's not rocket science.
Over the last few years, mental health courts and specialty courts have become pretty popular across the country, but you're not really a fan of that model. When you're dealing with somebody in the criminal justice system who's displaying signs of mental health issues, how do you prefer to handle them?
Do what we've done, which is not a mental health court or a drug court per se, but we have a diversion system in place. And so what we recommend is that the first thing every county should do is have what we call a sequential intercept mapping, where you have all the right stakeholders in the room and you map out the intersection where people are penetrating these deep-ended systems. And as a result of that, you can see all the gaps in your system where people are falling through. I think if there was any genius in what we did, this was it. We put together a written collaborative agreement that actually required a structural change on how all the different stakeholders were going to respond to these individuals so that we can fill those gaps that we had identified. And so I made everybody come in my chambers and sign the document, because we didn't have a new law. We didn't go to the legislature. A lot of this was done because, we could fix things locally. We didn't need a new law, right? State law already gives you the authority to do diversion. So we just needed to set it up in a way that worked. As a result of our program, the pre-arrest program, the number of arrests in Dade County went from 118,000 a year to 53,000. We closed one of our 3 main jails at an actual savings, not cost shift, of $12 million a year. It's now $132 million in real savings to the county. And we lowered our jail audit from 7,400 to 4,400. Um, it has saved the county so far 400 years of jail bed days, 400 years. It allowed them to put off building a new jail for at least a decade, which is a great thing because the cost savings are astronomical. We also set up a post arrest diversion system. And so if people do get arrested, we now changed the screening tool at the jail. And if you're in crisis and you meet criteria, we get you out of jail within 3 days. We send you to a crisis stabilization unit. And because you are on a criminal hold, the 72 hours under the civil commitment law doesn't even apply. And so we're able to set the case for 2 weeks, which is what most of this population really needs. And then when they begin to stabilize, we go meet with them and we encourage them to come into the program, which most of them do, because if they don't, they go back to jail and they're sick, they're not stupid, and they don't want to be in jail or a hospital. So they'd rather be with us out, and we get them all their needs. We assign them a peer immediately, which is critical. We get them housing, we get them transportation, we get them treatment, we get them on medication. And when we can, we put them on long-term injectable medications. And the results are stunning. Our recidivism went down from about 75% to 20% for misdemeanors, and from about 75% to 6% for felony cases. And so we know it works.
You mentioned that only 7% of mental health calls require police intervention. Should counties be trying to educate the general public to call for specialized help, or is it better for deputies to learn how to route those calls?
Yeah, I'm so glad you asked that question because the federal government's doing a pretty decent job of setting up the 988 mental health line, where you can call them instead. But I kind of like Dallas and Houston's model because I think it's really hard to get 300 million people to change their behavior. It's easier to get a few thousand people who are professionals to change their behavior. I kind of like go ahead and keep calling call 988 if you know about it, great. But most people aren't going to know it for years. It took America 40 or 50 years to fully implement 911. And this isn't nearly as, robust. And so what they do in Dallas and Houston that I like is you call 911, they have the 911 call takers trained on how to screen those calls. And if there's an indication of serious mental illness, they have a professional on the line that does a further screening, and they're going to make a determination if you need law enforcement or not. And they make the warm handoff to 988. So if you don't need law enforcement, they stay on the line, they call the 988 operator, they work through it, and they get a non-law enforcement response. And law enforcement may show up as backup, but they're not going to be the primary. And that's what you want. And the reason it's 7% is those 7% of the cases generally include, where there's a weapon or there's a threat of violence. And then you do need law enforcement, but it's only 7%. That leaves 93% that don't. And it's not always the best use of resources to be pulling a police officer, off their regular beat to handle someone with mental illness if they're not really required. The other reason you really want to do it is in most cases that it's not because it's not required. When they do have to civilly commit someone, they have to put them in handcuffs and in the back of the police car. And and even the officers don't want to do it, but it's standard operating procedure. They have to do it. So think about it this way. You have an 18, 19-year-old kid. He's had his first psychotic break. You don't know what to do. You call 911. A wonderful officer shows up. He or she is perfectly trained in CIT. They de-escalate. They do everything right. But then they have to handcuff the kid and put him in the back seat. The neighbors are all watching. The child is horribly humiliated. They're never going to trust their parents again. You've created a long-term traumatic crisis that may not go away that could have been avoided by just calling 988 and having an EMT or a professional show up.
So you have pre-arrest and post-arrest diversion programs set up. What's your next move?
When we started this 24 years ago, there was no research or data on trauma. It came out after us when we started, and it turns out that 92% of all the women in jail and prison in the United States who have serious mental health issues have really horrific histories of trauma, mostly sexual abuse when they're children. And about 75% of men who are in jail and prison in the United States with serious mental illnesses also have horrific histories of trauma. Sometimes it's sexual abuse, but more likely they have been victims of long term domestic violence, also in childhood, or they've been witnesses to really violent acts, no different than a soldier might see in combat. And, what we didn't understand when we started this is that trauma, severe trauma, is physiological. It actually alters brain activity. It's not an emotional response where you can shake it off and move on. And so a young brain that is exposed to trauma is damaged even more than an adult brain. So if we were to have done this again, and I really encourage your listeners that when they start to set up their summits, that they also invite the superintendent of schools and members from the school board, and other, child psychiatric professionals, um, because we should be doing assessments as early as early middle school. It would help stop a traumatic incident that may be going on at home. And B, it would certainly help get the child treated so that they don't end up growing up in the criminal justice system because we waited.
Who are these stakeholders you really need to bring together to get in a community to get things moving?
So you need someone that is perceived to be neutral. You need a leader. It doesn't have to be a judge, but a judge is always a good choice because we're like Switzerland and we're usually not party affiliated. Some places are. So you don't come in with some of the partisan baggage that happens these days. Um, so you need to have the right person to make the invitation. It could be a county commissioner, it could be a sheriff, it could be state attorney, it could be the public defender, depending who in that community has the respect. Um, and so you want to then bring all the essential stakeholders. So that's going to include the sheriff, some county commissioners, the State Department of Children and Families, your Department of Corrections, law enforcement, the elected public defender, the elected state attorney, judges, um, and family members, and consumers, people with lived experiences. Um, and you want to map it out, and you want to look at your gaps, because the gaps in Miami are going to be different than the gaps in DC, or wherever you're going to be. So uh, once you map it out and you see those gaps, you don't necessarily need a new law. You may later on, but initially, no. And I'll tell you the other thing, we didn't even ask for any new money the first couple of years, because it turned out in Florida, I didn't even know because I didn't know anything about this. We have what are called crisis stabilization units that the state already pays for, and they get paid whether they're full or empty. And we didn't know they existed, so we didn't access them. And so part of the collaborative agreement was that all the providers would take our population for diversion. So I didn't need to go out and build a new system. It was there. I just needed to learn how to access it. And I did that through collaboration, and have a way that when the person's ready to come back into the criminal system for monitoring, how do we do that? And how do we transport them? And, who's going to do it? And it's just being practical and just putting up a big chart on a wall and filling in those holes on how to make it happen. The initial collaborative agreement clearly has evolved, and it's amazing, and it has a million different components now. It's not just pre and post arrest. We have an alternative to competency restoration program, which counties should be very interested in, because the backlogs that are going on in this country has those individuals sitting in the local county jail for months, if not years, unnecessarily, at huge cost to the county. And so the county officials should be working with state officials to fix that system and limit competency restoration to the most egregious and dangerous offenses, and diverting the rest of the folks out much quicker and into treatment in the community, and monitoring them through the court so that you can improve your public safety and help this very vulnerable population get into recovery and have a life of hope and opportunity.
You've been an advisor to the Florida Supreme Court for the last few years. Tell me about the relationship between counties and the court.
Yeah, I'm really, really excited, and I'm incredibly optimistic that over the next 10 years, we're going to see huge change. And that's because there's an organization called the Conference of Chief Justices and the Conference of State Court Administrators, and they make up every single Chief Justice at every state Supreme Court and every state court administrator. And they recognized a few years back that mental health, untreated mental health, has such an enormous impact on the administration of justice that they needed to do more and get involved. And so they put together this task force. We helped them write this really remarkable report. It was unanimously endorsed. They have now put together an implementation plan. And their goal is to basically do what we've done in Miami in every circuit in the United States. And it's a heavy lift, but we're working. We have an organization that's training judges right now. We're hoping, our goal is to train 10,000 judges by the end of the decade. Not just about the illnesses, but how to actually make these structural changes. And the Conference of Chief Justices put together this implementation team, and they're working from their level to make sure this is going on. And it's remarkable to watch. And I'm in an airplane almost every week, and to hear all these judges talk about how to fix their system is really heartening. I remember when we first started, I had to convince people there was a problem, and now they don't want to hear any of that. They just want to know how to fix it, and that is a great sign that we've come a very long way, and we're now teaching them how to fix it, and it's fixable, and it's nobody's fault. And it happened because when the community mental health system was established in this country, the most acutely ill with the psychotic disorders were still in state hospitals. So we designed a community mental health system for people with moderate mental illnesses, not acute. And when we shut down the hospitals, which we have done, when we went to the war on crime and drugs, when we massively cut back housing, and we went to sentencing guidelines, this population got thrown into communities with systems that were not designed or developed for them. And so, of course, they failed. And unfortunately, instead of blaming ourselves for not creating a system that worked, we kind of blamed them and threw them in jail. And so now we're doing it the hard way. And we're building the airplane as we're flying. But we're getting there, and we know how to do it. And, thanks to programs like NACo stepping up and people like Matt Chase, who really understand these issues and has really helped guide his membership to do the right thing for the right reason, it's changing. And so it really does require this collaboration between the local court system, the state court system, and the local county government to make it work.
That was our interview with Judge Steve Leifman. Charlie, what a great conversation. Thanks so much for sitting down with him. If folks took an interest in this, there's so much more content, so much more video content, especially if you visit the Mental Health Awareness Month page on NACo.org. And of course, if this is an issue of importance to you and your county, the work of NACo's Commission on Mental Health and Wellbeing will be coming to a close at the 2024 annual conference. So we're looking forward to the release of their final report. And I think you'll be there for some of those sessions, right, Charlie?
I will.
Well, we're really looking forward to hearing what they have to say and to sharing that resource broadly with our NACo members. If you are interested in attending that annual conference, of course, it is in Hillsborough County, Florida, July 12th through the 15th. Information about the Mental Health Commission, information about mental health awareness, and about the annual conference, all available at NACo.org. And with that, I think that's everything we have for today. Stay tuned for our next episode of the County Countdown, and of course, for a new series you may have heard we'll be launching in partnership with the National Center for Public Lands Counties. Charlie, with interviews hosted by you.